Welcome to NOCC's 2024 Summer Online Wellness Symposium. This is our first session for our summer symposium entitled Keep Smiling, Oral Care Tips During Treatments and Beyond. As I mentioned, my name is Karen Young, and I am the NOCC Midwest Senior Regional Manager. The NOCC online symposiums for both summer and fall are intended to provide you with the following things. We intend to provide a better understanding for you and your loved ones' diagnosis and its side effects so that you can make informed health decisions along with your doctor. We also hope to provide ways to cope and manage side effects, including stress and anxiety, also self-care strategies, and finally, through online, although online, we are able to connect and engage with each other. So we hope to promote peer-to-peer connections so that you feel a little less alone through these presentations. I'd also like to take a moment right now to sincerely thank our symposium sponsors who are dedicated to providing learning opportunities and programming for our teal community. So thank you so much to GSK, AstraZeneca, Merck, and Eisai. Okay, now for our program this evening. Dealing with cancer treatment side effects, including oral changes, can be tough. These changes might cause discomfort and other quality of life challenges. And so during this program, our speaker is going to discuss some basics of oral care and the possible side effects that you might expect from treatment. So I am pleased to welcome our expert this evening, Jill Meyer-Lipper, a registered dental hygienist and founder of Side Effect Support. Jill, we are so glad to have you, and I am going to turn it over to you this evening.
Awesome. Well, thank you so much for the invitation, and thank you to everybody who's joining us tonight. I'm just going to share my slides here. Can you see that okay, Karen?
Yes.
Okay. All right. So as mentioned, my name is Jill Meyer-Lipper. I'm a registered dental hygienist, and I'm the founder of Side Effect Support, which is an online resource for cancer patients, family caregivers, and healthcare providers to help reduce oral side effects of treatment. So we'll go through some of what those side effects can be, some of the challenges, and some really simple tips of things we can do to hopefully prevent or keep them under control. So my motivation for really being interested in the oral health concerns of somebody that is dealing with a cancer diagnosis is my mom. I started my very first job in the dental field back in June of 1992. And within that first week that I started my new job, my mom announced that she was diagnosed with breast cancer. And her diagnosis was followed by a mastectomy and what was supposed to be 6 months of chemo that ended up being 7 months of chemo because of some delays. And she suffered, with a lot of different side effects from her chemo, but especially side effects in her mouth, where she had such dry mouth that she would actually choke from her tissue sticking together, but it hurt to even drink water because she had such big mouth sores. She was just very uncomfortable. And I remember her being anxious to go back to her appointment and ask her oncology team, what can I do? I'm in so much pain in my mouth. And she came home feeling so defeated because they basically just shrugged their shoulders and said, it's just part of treatments, you need to deal with it. And I found that very difficult to accept. And now that I, just started my first job in dentistry, I thought very foolishly that I was going to save the day. I was going to be able to ask my new coworkers, what we could do. I was already starting my classes for the dental hygiene program. And I found that not only did maybe her oncology team not necessarily know what to do, but we didn't really know what to do on the dental side either. And there was just this gap in care that was really evident. And it lit a fire in me to want to learn more, that even if I couldn't help my mom during her journey, I knew that I would be having other people in my dental chair at some point that would be facing a cancer diagnosis or a survivor, that I need to know this information. So I really started to try to learn more, and I found that the information was very limited for us, what was available. So every patient who came into the dental office where I work that had cancer in their medical history, I just viewed as a learning experience. I'd question, what kind of cancer did you have? What kind of treatments did you have? Did you have problems inside of your mouth? What did or didn't help you? And it didn't take long that I started to notice some patterns where not everybody had problems inside of their mouth, but a lot reported that they did. For those that did, very few reported that they were provided any type of guidance of what they could do to possibly prevent or manage the issues. And a lot of them just felt very unprepared for what they were going to be dealing with. So it was evident that there was a disconnect, that this lack of communication between medical providers and dental providers was leaving our patients with not only an inadequate amount of information, but sometimes really inaccurate information that was ending up making their problems worse as time went on. And my golden example of this is I had a longtime patient who was a breast cancer survivor, and unfortunately it had come back. And when she started her treatments, she did get clearance to continue on with her regular recall appointment. So I was able to see her back the first time. Of course, my first question is, are you having any problems inside of your mouth? And she said, oh yes, my medications are making my mouth so dry, but it's okay because the nurses told me to suck on lemon drops, and that really seems like it's helping. And I was shocked because from a dental perspective, that is one of the worst things you can do. To have somebody with a dry mouth who's very susceptible to cavities, to infection, and having them suck in an acidic, sugary substance is just a recipe for disaster. So I was very surprised that that was the case, that this would be a recommendation, but I have found that that is what many medical providers are trained to recommend. And to this day, there are some infusion centers that still keep out big bowls of Jolly Ranchers or lemon drops for their patients to suck on during treatment. So we've come a long ways since 1992, but we really do have a ways to go yet. So fast forward a few years, and my dad ended up with a cancer diagnosis, and we unfortunately, he did not make it through his treatments. And after that happened, it was really a motivation to me that I wanted to take these bad experiences and make something good come out of it. So I created a volunteer program at our local oncology department where my dad received treatments, where everybody who started treatments, whether it be chemotherapy or radiation to the head and neck, they received a goodie bag. And I believe everybody received a link that had the informational pamphlet that I've designed. At the time, it was basically a little colored lunch bag with some information and a sampling of products. And now that has grown into a little bit more finely tuned oral care kits. But I kept that going pretty strongly from 2006 till about 2010, until companies were no longer willing or able to donate the products that I needed to put in the kits. And as the kits were getting smaller, I realized I needed to either forget about the program, and that thought really broke my heart, or I could take a leap and try to expand it in some way. And that is how the idea came about, to form Side Effect Support, to create an easy resource of information for not only for cancer patients and their family caregivers, but also for us as healthcare providers, so we can help get the medical team and the dental team more on the same page with our recommendations. So I want to go back and just kind of do a review on basic information about oral health. So these are just some fast facts from the CDC, that oral health is essential to general health and well-being. And not only can the pain and infections be uncomfortable, they can cause trouble with eating, speaking, and learning. They can affect social interactions, employment opportunities. And the main three conditions that they focus on are cavities, gum disease, and then tooth loss. So we're going to look a little bit more at cavities and gum disease, so we all really understand what we're looking at there. So what determines oral health? What makes one person have a healthy mouth and the next person not have a healthy mouth? And it really comes down to what's called the oral microbiome. So we have many, many different types of bacteria and organisms that live in our mouth. And they're not all bad. We have, if you think of the organisms in your mouth almost like a community or a city, you have community members that are not beneficial to the community and they cause destruction. And you have other members of that community that are beneficial and they make the whole community a healthier place. And the same thing goes with the bacteria inside of your mouth. So there are different things that affect your oral microbiome. You know, what makes one person's microbiome be better than the next? One can be genetics, and usually, you know, that's not common reason. A lot of times, like through my years as a dental hygienist, I would many times hear people come in and say, I just have bad teeth. Everybody in my family has bad teeth. It's just the way it is. And they just kind of accept it and give up on what they can do about it and the control that they have. So most of the times it's not necessarily a genetic issue, but a lot of times it is when you see that in families where many people in the family all have a lot of cavities or they all have gums disease. A lot of times that's from sharing germs. So whether that be kissing, you know, parents can help kind of pass those germs on to their children. You can share those germs through intimate contact, by sharing utensils, by sharing, you know, if you have a baby and sometimes moms will take a spoon and they'll eat something off and feed it to the baby. That's basically inoculating that child with whatever bacteria is in that mom's mouth. It's affected by oral hygiene habits. So the cleaner your mouth is, the healthier your oral microbiome tends to be. Is also professional dental care. You know, how often are you seeing your dentist and dental hygienist and having your regular preventive care appointments? Diet and lifestyle choices have a huge impact. And also medications and other medical conditions can affect that oral microbiome. So it's important to understand also that oral disease and oral health problems don't necessarily stay confined to the mouth. There's what is called the oral systemic link, and we are learning so much more about the way that oral health is connected to other diseases. And they've found that people that have poor oral health are more susceptible to heart disease, to stroke, to erectile dysfunction. And the concept with that is that that might actually be a precursor that some people will see before moving to the heart disease by affecting those small vascular vessels. They're more susceptible to asthma and respiratory infections. Alzheimer's disease is something just within the last couple of years has been a real breakthrough that they have actually isolated specific oral bacteria inside of the brains of some people with Alzheimer's. It makes, if somebody has poor oral health, they're more likely to have pregnancy complications. It makes them more susceptible to diabetes, which has a very reciprocal effect because diabetic patients are more susceptible to getting oral disease. So then the more oral disease they have, the harder it is to keep their blood sugar levels under control. And they just kind of, they can get in a real bad spiral and have a hard time getting out of that when you have diabetes. It has also been linked to the likelihood or more susceptible to developing certain types of cancers. And certain oral bacteria is now being identified as making certain cancers maybe more aggressive or more difficult to treat. So while this sounds maybe kind of scary for some people, it is amazing what the potential is with this information. So as we're learning more with this, this is going to give us in the future the ability to have better methods of prevention, early diagnosis, and possibly better treatment options for all of these different types of issues. So I want, when we're looking at cavities, it's very helpful to understand the anatomy of the tooth. So it's kind of a goofy analogy, but I think it's really effective. If you think of a tooth like a peanut M&M, the outside hard candy coating is your enamel, and that's the hardest part of your tooth. And underneath the enamel is your softer chocolate, that's called the dentin, and that is softer in the tooth structure as well. And in the middle of the tooth, the very center where your peanut would be, that is your pulp chamber, and that's where all the blood vessels and the nerves enter into the tooth, and that's what gives a tooth life. So when we have a cavity starting, we ideally want to catch it as early as possible while it's still in that hard outer enamel layer. Because once it breaks through that layer and gets into that softer dentin, that's when it can start to really spread faster and get really large underneath. It kind of mushrooms out. And if it gets through that dentin and into that pulp chamber, that is when we become very limited on what we can do to treat it. If it gets into the pulp chamber, we basically have two options. We can do a root canal, which is basically making a hole in the crown of the tooth and using little files to remove the nerves and the blood vessels inside of that pulp chamber, and then putting a filling material inside of it to hopefully hold everything together. Or we could take the tooth out. And those are pretty much our only options. So neither of those are ideal. So the sooner that we can catch areas of concern, the better for everybody, where we can keep it conservative. And that's one reason that having dental x-rays on a regular basis is really beneficial, because that helps us find, especially where those teeth are touching together, where we can't visually see the cavity, we can hopefully catch things earlier and keep the treatment conservative. It's also helpful to understand what gum disease is, and there's different levels of gum disease. There's what's called gingivitis, which is the inflammation of the tissue, or there's periodontal disease, where if you look at that x-ray on the right again, you can see all that kind of spongy looking bone structure. That is the jawbone that holds the teeth in place. It's called alveolar bone. And if the tissue gets irritated enough, you can start to have that bone recede. And that's what periodontal disease is. It's the loss of that support structure of the tooth. So in the picture, you can see that little probe. And I have an example of a probe here. So this is what we would use if you go to the dental office. You probably remember your dental hygienist calling off numbers. She maybe, dances this around the tooth a little bit. It actually goes in between the tooth and the tissue and measures how deep the space is between those tooth and tissue. And it's natural that the tissue is not connected all the way up to the top of the gum line. Every tooth has a little cuff that surrounds it. So this is measuring how deep that cuff is. So she's calling off numbers like 2, 3, 4. Those are millimeters. And we ideally want that pocket depth to be deeper than about 3 millimeters, because that is still able to be accessed with cleaning out at home. Once you get deeper readings, it's either showing inflammation of the tissue, it's just puffing up and raising deeper on the probe, or is showing signs of periodontal disease, where that tissue can start to disconnect away from the tooth. And as that pocket gets deeper, it's easy to get in kind of a snowball effect, where the pocket's deeper. So now it's harder to keep clean. You can't access that deep at home with your home care. So now the bacteria have a nice little reservoir to kind of hide themselves in and cause more destruction. So you could technically have somebody that has never had a cavity that could lose all their teeth just from losing that support structure. And depending on if somebody is more susceptible to cavities or susceptible to gum disease, that again goes back to what kind of bacteria are in their mouth and all of those different aspects that affect what the microbiome makeup is. So for somebody that's been diagnosed with cancer, unfortunately, there are many different types of cancer therapies that can affect oral health in one way or another. And the reality is, for most people, you don't tend to have just one of these therapies. Even if you're having chemotherapy, a lot of times it's a chemo cocktail. So you might have, different risks with each different medication that make up that cocktail. A lot of times there can be adjunctive types of therapies like hormone suppression, or steroids can come along with the chemotherapy, or sometimes even anti-anxiety and anti-depressants can affect oral health. Sometimes dietary changes, all of a sudden more Ensure and Gatorade and things like that. And even pain medications can affect oral health in some way. And for a lot of these, and we'll go through, what some of those types of side effects are, but my battle cry is truly early intervention and patient education is key to helping to reduce the risks. Even if we can't completely avoid all the problems, if we can anticipate what the potential issues could be and take action before they even start, we hopefully can minimize their effects on the line. So what kind of oral health risks are there? And this is all depending on the type of cancer and the type of treatment. So not all of these are applicable for like an ovarian cancer situation, but many can be as well. And just for time's sake, we are going to focus more on the dry mouth because that is so common. And it's very common not only in cancer situations, but for many different types of medications, and whether they be prescription or over the counter. We're going to talk about oral mucositis, which is mouth sores. And then we're going to touch a little bit on the osteonecrosis of the jaw from medications, because there are some medications that may be used with different stages of ovarian cancer that could put somebody at risk for that. So we'll talk more about that. So with dry mouth, it is important to understand that it's not just a comfort issue. And unfortunately, dry mouth a lot of times is treated just like that's all it is, whether it be from the medical team or the dental team. And they don't always really appreciate how wonderful our saliva is. Our saliva has natural protective elements that help to lubricate the tissue, so it helps to prevent wounds and damage of the tissue. If a wound would occur in the tissue, it plays a role in healing. There's all sorts of infection prevention aspects of saliva, whether it be bacterial infections, viral infections, fungal infections, like thrush is sometimes a big issue for people while they're in treatments. It helps to buffer the oral pH, and we'll talk a little bit more about pH, that'll make more sense, and that goes hand in hand with remineralization of the tooth structure. It's the first step in food digestion, and it also plays a role in taste, because there's certain taste buds on your tongue that are dependent on saliva to function properly. So a dry mouth is going to be more susceptible to having taste distortion, which can also be a big complaint for people during treatments. For some simple tips, one is to stay hydrated. Make sure that you're getting lots of water. Dietary changes, avoiding foods and drinks that can be drying. So that could be caffeine, alcohol beverages. Avoid dry, crusty foods, and adding a lot of sauces and gravies, keeping the dish as moist as possible. Breathing through your nose, which sounds really simple, but some people just through habit or through sometimes maybe having some trouble breathing through their nose are mouth breathers. And you can do all these other things to try to help remedy the dry mouth. But if somebody has that habit of breathing through their mouth, they will constantly be battling that dry mouth issue. So sometimes it's just being aware. Especially when you're just sitting in a rested situation. There's a saying, lips together, teeth apart, because you don't want to clench your teeth, and just making sure that you're breathing through your nose. And if you do have trouble breathing through your nose, sometimes even a simple nasal, like a saline nasal rinse or a spray may be enough to help lubricate those nasal passages to make breathing through your nose more comfortable or possible. And for some people, using a humidifier, especially at night, can be beneficial as well. And there are many prescription and over-the-counter dry mouth products that are available, and that number of dry mouth products on the market is growing. Manufacturers are taking note of what a common problem this is, and there are more and more products that are coming out. The thing to keep in mind is there's truly is no one size fits all. This is something that through the years, I would have people in my chair that, I could see their tissue was dry, and I would ask them about it. And they would sometimes say, well, I just, I went to the big box store, I went to the pharmacy, I just picked off, the only products that sounded familiar from the commercials, or, looked at something that said for dry mouth. I tried a couple of them, they didn't seem to work, so I just gave up. So my point with this is really to say it isn't, there's not going to be a magic bullet. So hopefully just being open to trying different things, seeing what works best for you at this point in time, and just understanding as your medications change, as your body chemistry changes, what works really well for you at one point, might not work as well for you at another point. So then it's just being open again to trying some other products. But that being said, I would recommend getting product recommendations from a trusted dental professional. And we're going to talk a little bit about why some products may help to mask the symptom, but they may actually help to contribute to damaging oral health down the line. And it makes me think of that just like the lemon drop, but sometimes it's actually in oral health products. So that means looking at oral pH and oral diseases. So our pH inside of our mouth, a healthy pH is around a 7, and that's considered neutral. And when you go into the lower numbers below 7, those are acidic numbers. And if you get into the numbers above 7, those are considered alkaline. So when we have a normal healthy mouth that's around, hovering around that 7, it is natural for all of us when we eat or drink anything, our oral pH plummets down into those lower levels. Everything turns acidic. And when that happens, we start losing some nutrients from the tooth. It's called demineralization, where the tooth starts to leak out calcium and phosphate, and the tooth gets weaker. And then after about 30 minutes or so of an acid attack, then our saliva helps to buffer the oral pH and helps to bring it back up into those higher ranges towards that neutral. And that's when we have remineralization, because those healthy elements of saliva will help to strengthen that tooth again. So basically every day through our lives, our teeth, our base are breaking down and they're building up, and they're breaking down and building up. The problem is when we have a dry mouth and you don't have that healthy saliva to help remineralize and to buffer that oral environment, the mouth tends to hover in that acidic state. And when that's the case, we are in that kind of demineralization mode, and we don't get to remineralize the teeth. And that's why dry mouth sufferers are so much more susceptible to cavities, because they never get that full remineralization to strengthen the teeth back up. So knowing that, this is a study that was done out of the University of Florida back in 2018, where they tested 11 dry mouth lozenges. And out of that 11, they found that only 2 of them were in a safe range. The safe range ones were called Sally's and Xylamel's. And those had a higher pH, more into that neutral or alkaline range, that helped to reduce that acidity inside of the mouth. So if you look at some of these that are listed on here, looking at like a 2.9, a 3.1, that pH range is actually equivalent to what you would get like by drinking a soda. So you can imagine how using those on a regular basis would be kind of like sucking on that lemon drop. It would be exposing that to that constant acid attack. And this is a list of different mouth rinses. I borrowed this list off of a product site called Carry Free. When I show these lists, I do like to say take it with a grain of salt, because products can change. So even though when this list was made, and they did their research on what the pHs were, products sometimes they'll keep the same name and they'll change the formulation, or they'll keep the same formulation and they'll rebrand the name of the product. So this isn't going to be accurate forever. But again, it has a line there around that 7 range, where we'd like to be at least close to that, or if not above. But when you get down to some of those lower levels again, those are very acidic. So for somebody that has dry mouth especially, they're having an acidic environment, they're having sometimes being exposed to a lot of acidic foods, acidic drinks, acidic oral care products, sometimes acidic medicines. And then that can really just all work together to cause havoc inside of the mouth. I do want to touch on oral mucositis. This is also a common problem to have that can range from either just a tenderness of the gum tissue all the way up into large mouth sores that can make eating very difficult, and it can make somebody much more susceptible to getting infections with having those open sores too. So as far as, some people are more susceptible to getting oral mucositis than others. And of course, it depends on what your treatment regimen is. But even for people that have the same treatment regimen, some may be more susceptible than others. And there's certain risk factors, and there's ones that we can't control. So like the extremes of age, if somebody's, very young or the very old, they're going to be more susceptible to getting it. The extremes of body mass index. Females are more susceptible than males. Even certain races are more or less susceptible than others. So even though we can't really affect those things, we want to concentrate on the things that we can modify in some way. And that would be treating the dry mouth, keeping that tissue as lubricated as possible. For existing dental issues, what I mean by that is that somebody that goes into treatments with a very healthy mouth is less likely to have some of these problems. If somebody goes in and has a lot of irritation already, that starts that inflammatory process that can lead into mouth sores. So it could be something as simple as, a spot that catches food really easy. It could be a sharp edge of a cusp that rubs on the tissue. It could be a partial that doesn't fit properly. Anything that causes that irritation can lead into ulcerations. And then poor oral hygiene. Somebody, again, with a very healthy, clean mouth is going to be less likely to develop oral mucositis versus if there's a lot of plaque buildup that is going to make people more susceptible not only to developing the mouth sores, but also to getting those mouth sores infected. And what tends to happen, especially in chemotherapy, is somebody, when you get your infusion, maybe about 7 to 10 days after is when all of a sudden the blood counts start dropping, the tenderness of the tissue can start, and then it'll go through, a certain time period, and then it'll start getting better. And right by the time you feel better is when it's time to go back in for that next treatment, and you go through it all over again. So when we know that somebody is susceptible, that they might develop oral mucositis, if we can address some of these issues early on, hopefully we can help delay the onset of that, because let's say if you went in for that first treatment and you ended up with mouth sores right away, every time you go in for another treatment is that much more likely to happen, and it's that much more likely to be more severe each time. So if we can at least delay how far along in the treatment process that they'll start, that can help so that it doesn't keep snowballing and get worse and worse as time goes on. So medication-related osteonecrosis of the jaw, this is something that for some people with different stages of ovarian cancer, depending on the medication that they're taking, there can be a risk for this condition. When you break down what the name means, it sounds awful. The osteonecrosis means death of bone, so it's death of the jawbone. So the signs and symptoms of that are kind of across the board, where there may be, pain in the jaw, there could be drainage, there could be loosening of teeth, there can be like an exposed bone. It can kind of go through a list of possible symptoms like that. The types of medications that may put somebody at risk would be like Avastin would be one, Zometa, Prolia. Some of those are either to help restrict blood flow that reaches the tumor, that helps, to starve the tumor, basically. And other ones deal with bone building. That's what like the Zometa and the Prolia, especially if there is an advanced stage that maybe has spread to bone in some way, that helps to reduce risks for bone complications. The risks are low for the osteonecrosis of the jaw, but even though they're low, they're real. So my thought is I don't want anybody to be afraid. I don't want anybody to say, oh no, I don't want to take that because I'm afraid of this happening. Definitely nothing like that. But I want just us to, again, approach this in a very proactive, preventive way. If we know somebody's at risk, what can we do to help reduce those risks? And I think those are the biggest things. Once osteonecrosis starts, it can be very, very difficult to get under control. So really focusing on prevention is the biggest thing that you can do. One of the things is good communication between your medical team and your dental team, which doesn't always happen. Unfortunately, we need to all be much better at that. But in the ideal world, before anybody would start one of these medications, the dental team would be part of the equation. So before the medication would start, having that patient see a dentist, make sure that there's no teeth that are at risk for needing an extraction, because the vast majority of cases are caused by trauma to bones, like extracting the teeth or something like that. We need to make sure that the dental team understands what the risks are, so we are treating you safely, and making sure that you are empowered to keep everything as healthy as possible to prevent needing an extraction. Because once you start these medications, they can stay in your, even if you have stopped them at some point, they can stay in your system for a really long time. So that risk may last longer than what the medication is being taken for. So I want to just look at some simple tips of things you can do to help keep your mouth healthy at home. And especially when you're in the middle, or when you're starting treatments or in the middle of treatments, the size and shape of your toothbrush is actually really important. So this is an example of, a toothbrush that you might find in your drugstore when you go buying them. The head is huge. I always say that looks more like a hairbrush than a toothbrush. And a lot of times the bristles are medium or hard bristles. They're very stiff. What ideally we want somebody, if they're going to treatments or if they're at risk for some of these issues, we want them to use an extra soft compact head toothbrush. This one in particular is actually called a post-surgical brush. It's almost as soft as a baby's hairbrush. It's very, very gentle. And this helps to clean gently without causing toothbrush trauma. And it also helps if the gum tissue would start to get sore at some point. It helps keep the brushing more possible. There are also many different brushes in all sorts of sizes. And there are specialty brushes that are nice and small to help reach in difficult areas. But sometimes I know people think, well, I'll have more surface area if I use a nice big brush. I won't have to work as hard. But unfortunately, it's harder to clean with a large brush. So you want a small, compact head, extra soft bristles. You want to replace those bristles as soon as you start seeing bending or fraying. And the softer your bristles, the sooner that's going to happen. But that's okay, because if you are replacing that toothbrush on a regular basis, that helps that you're not getting bacteria building up on the bristles. And especially if you're susceptible to mouth sores, you don't want this to end up being an infection source. And this is one thing that if you look at how a lot of people store toothbrushes, you walk into people's bathrooms, and just like in the photo here, they're all sitting in a cup touching each other. And this is a great way that bacteria or viruses or anything that's on one person's toothbrush gets transferred to the next family members. And if you have a nice, healthy, robust immune system, that's probably not going to be that big of an issue. But if somebody's in treatments and your white counts are really low, this is a way that sickness can spread. So it's good to keep your toothbrush separate in some way. I just have in here too, like sharing is not caring. So just as you are not supposed to share unwashed utensils or unwashed cups or lip balm and things like that while you're in treatments, same thing with, you don't want to share a toothbrush. You want to keep it separate from everybody else's. Sometimes people say, oh, I use one of those travel plastic caps on it. But for anybody that's used those, when you take that off and you see that like white film that builds up in there, that is what's called a bacterial biofilm. That's basically just encasing your toothbrush in a nice little greenhouse of bacteria. So keeping it separate, making sure that bristles get to dry out in between all the uses, that it doesn't stay wet. There are also little disposable shields that you can get on the market too, that they help to wick moisture away so those bristles can dry out faster, but then they prevent that contact contamination or anything else that's floating around your bathroom. You think of even having them out near a flushing toilet and things like that. So just being protective. I also do recommend that when people are in treatments to consider using your own tube of toothpaste. I'm guilty of this myself. When I put that toothpaste out on my brush, I often will dip the end of that toothpaste tube to try to get that last little bit off, especially if you have kids, it's probably all smeared full. But that now when it's touched the end of those bristles, that end of the toothpaste tube can be contaminated with any types of germs that have been on this toothbrush. So you can transfer germs from one family member to the next through that end of the toothpaste tube. So using your own tube of toothpaste is just one extra simple thing you can do to help reduce germs. For detergents, there are certain chemicals in many toothpaste and oral health products that can be considered tissue irritants. Two of them off the top here, the most common one you're going to see is sodium lauryl sulfate. It is a sudsing agent that gives this toothpaste a nice thick consistency. It helps it to foam well. So that's when you get that nice foamy feeling, like you're really cleaning well. Unfortunately, sodium lauryl sulfate is known to be a skin irritant for many people. This is a chemical that oftentimes I would have people that would come into the dental practice and they had trouble with canker sores. You know, they're just constantly getting canker sores and they don't know what's happening with that. Or they maybe have this condition called burning mouth syndrome where their mouth just is uncomfortable a lot and they get this burning sensation. This would be the first thing that we would cut out for them, is remove sodium lauryl sulfate from your oral care products, and it really was amazing the difference it could make for people. Another one that was seen less often is cocamidopropyl betaine. It's a fun word to say, but this is something that you sometimes will see toothpaste, especially that'll say, hey, we're SLS free for the sodium lauryl sulfate, but they replaced it with cocamidopropyl betaine, which for some people can also cause tissue irritation, and so much so that the American Contact Dermatitis Society gave it this goofy little award back in 2004 as Allergen of the Year. Other ingredients to possibly avoid if you're going to be at risk for dryness of the tissue or irritation of the tissue, like the mouth sores or tenderness, would be anything that can dry, like alcohol, whitening agents, tartar control, and even be just mindful of the flavors, because especially if somebody does have tender tissue, mint or cinnamon may just feel too sharp. Sometimes using children's flavors can be more agreeable and more easy to keep brushing. Otherwise, there are other toothpastes out now that are very mild in flavor or some unflavored paste. Many times during treatments, there may be a recommendation of baking soda and salt water rinse. This is very common, and there's all different recipes for that. But this one in particular is recommended by the International Society of Oral Oncology, and they have recommend 4 cups of water with a level teaspoon each of baking soda and salt. Just putting it in a closed container, mixing it up real well. You can use it throughout the day. And then if there's anything left at the end of the day, just dump the rest of that out and mix a fresh batch in the morning. And this can also help to be soothing to the tissue and help to also keep that pH in balance with the baking soda. Fluoride may be recommended. Sometimes if somebody is going to be more susceptible to cavities, and we need to really be cautious of them needing an extraction and thing like that, fluoride can be a really nice option for keeping teeth strong. There are different types of fluoride. There's what's considered systemic fluoride and or topical fluoride. So the systemic is what is added to like municipal water supplies. And that is something that truly is meant for the benefit of children while their teeth are forming. If people are drinking fluoridated water while their teeth are forming, their teeth form harder. So they're more resistant to getting cavities. Once you have all your adult teeth, that fluoride in your water isn't really doing that much for you. You're getting more of a benefit by using it in a topical manner, whether that be through your what you get in your toothpaste, if you're using a fluoride rinse, if you have a fluoride gel. Sometimes you can get, your over-the-counter products have a certain range or a concentration of fluoride, but you can also get prescription fluorides that have higher concentrations to even protect your teeth more. Sometimes they may even recommend your dental office, they may recommend doing fluoride trays where you can have impressions taken of your teeth. They make customized trays, and then you can just put a little ribbon of fluoride and wear those in for like 5-10 minutes every night. That is something that can be very beneficial, but during treatments, it's not always possible for people to use that consistently through the whole treatment process because of maybe nausea issues or tissue tenderness. So I usually tell people if you are using fluoride trays and it gets to a point that it's just a little too much for you, you can back off and you can go to brushing that on, and then just go back to the trays when you feel that you're ready for that. But also it's good to check those fluorides for the potentially irritating ingredients as well, especially those detergents that we talked about. There are also some different types of sweeteners that you may find inside of oral care products that can actually benefit your teeth and help to protect against cavities, and actually help to improve those oral microbiome. So the most common ones that you're going to see, really the only ones, are going to be xylitol. That's what the xylitol is, xylitol, and erythritol. Xylitol is the one you're going to see more frequently, but I do see more and more products coming out with the erythritol. So I'll just kind of focus on the xylitol, but they're very similar in how they work. Xylitol looks like sugar, it tastes like sugar, but it has a different carbon structure. So when we eat sugar, those certain types of bad bacteria in our mouth can digest that sugar to create acid, to create cavities. They cannot digest xylitol. So if you're using products with xylitol, like 5 exposures a day, say like a 6 to 10 grams of exposure a day, it essentially starts to starve those certain types of bacteria. And then it actually helps, then you get rid of more of those bad bacteria and you get the more of the good bacteria being able to kind of overpower them. Xylitol can also help to buffer the oral pH. It's digested as a fiber, so it's best to introduce xylitol slowly into your routine. If you've never used xylitol before and all of a sudden you're using, a xylitol toothpaste, and you're using a xylitol rinse and a xylitol gel or spray, your stomach may start to get a little irritated with that. So if you introduce it slowly into your diet, typically your body is able to adjust so you don't have any gastrointestinal issues with it. Every once in a while, you'll have somebody that maybe is a little sensitive to it. But we have found that if you do have GI issues, it's less likely to occur with the erythritol than it is the xylitol. But it is important if you're using xylitol products to keep them away from your dogs. Just like grapes, raisins, chocolate are fine for us, but could be toxic for our dog. The same thing with xylitol. Just like the bad bacteria in our mouth can't digest it, dogs cannot digest it either, and they can get very, very ill if they get into xylitol products. So as we're learning more too about the oral microbiome and that we've got good bacteria and we've got bad bacteria, there is becoming a mind shift in the dental industry. I can tell you from being in the dental industry for 30 years that there was this mindset for a long time that we just need to kill all the germs. But you use all these really strong antimicrobial rinses and things like that. You're not only killing the bad bacteria, in those cases, they're killing the good bacteria too. So then you don't end up having a healthy mouth because you're trying to kill everything off. So we're really trying to focus more on now nurturing the oral microbiome. So we nurture those good bacteria so they can overpower the bad. Ways that we can do that is by using things like xylitol, having certain ingredients like arginine, dietary changes that help to feed the good bacteria so they can be the more prevalent types of bacteria inside of the mouth. And there are now different tests that can be done. There are certain tests that you can actually see what type of bacteria make up your personal oral microbiome and then get personalized recommendations on the things that you can do to help improve it in all different areas, whether that be with cavities, gum disease, bad breath, all of those types of things. And there's now options of oral probiotics. So just like people can take probiotics for gut health, there are now probiotics where they're just lozenges that you can suck on or chew up. And it helps to introduce good, healthy bacteria back into the oral environment. So we're just going to round up here with a saying that I had a patient that had went into breast cancer treatments, and I was able to talk with her before she went in, and she understood what the risks may be. We got her all prepared with everything she might need. And when I was able to see her back that first time after her treatments were done, she had told me, she said, "Oh, Jill, I'm so nervous what you're going to find." She said, "There's just so many times I did not feel like brushing." She said, "I was tired. I was nauseous. The last thing I wanted to do was stick a toothbrush in my mouth." She said, "I kept telling myself, my hair will grow back, my teeth won't." And this just struck me so much at that point. I'm like, how true is that? You know, hair loss is traumatic, and I never want to downplay that in any way, but it will grow back. Teeth problems are things that they're not going to grow back if there's a problem with that. But even the problems that happen during the treatment process can lead into long-term issues. And that was one of the biggest things when I really started learning about that is learning that sometimes people struggle with oral health issues because of the problems that they had during treatments for years after the fact. So if we would all look at preventive aspects of dental health for our patients, that would be so beneficial, not only during the process of the treatments, but through all those survivorship years, because it is not just about surviving, it is about having quality to your life. And having quality to life means being pain-free, being able to smile, and having a good oral, having good oral health is really a big part of that. So this is my contact information. I know we're going to go through some questions, but if anybody comes up with questions afterwards, you are welcome to reach out to me anytime, and I'd be happy to go through any of those with you.
Jill, thank you so very much. Oh my goodness, this has been such a wonderful presentation, and we do have a number of questions that I want to read to you. Been very engaging, and just thank you so much for all of this helpful information. Let's see, the first thing, back a while ago when you were talking about demineralization, somebody asked, does mineralization toothpaste help?
Yes, there's certain toothpaste that's where fluoride comes into play. There's certain toothpaste now that have an ingredient called hydroxyapatite. So there's different types of toothpaste, but yes, if something is meant to be remineralizing, that is supposed to help keep that process along and to keep the teeth stronger.
Wonderful. Somebody else wanted to know, Jill, who makes the very soft toothbrush that you have?
This one in particular is, let's see, I had a couple of them. This one is made by the Sunstar Gum Company. Sunstar actually has Sunstar Butler Gum. That's all part of the same, but this is the gum toothbrush. This is a post-surgical brush. These two are very, very soft, and they're very compact head. These are made by Tepe. And Tepe has a whole line of specialty brushes. And these are things too that one of my goals with Side Effect Support was not only providing free information for patients or for everybody, but also to give access to products too, that if, you know, the people I always feel it's so unrealistic to tell people, okay, this is what you should get, and then not provide them a resource for it, you know, and they, you know, when somebody especially isn't feeling well, to go to store trying to figure out what they need, it gets very confusing. So that is also just meant to be a resource for that.
Sure, thank you. Another person said, I'm supposed to have a tooth extracted next week. I'm on Avastin currently. Also, I have been on Prolia in the past. Last treatment was in September of last year. Should I go ahead with the extraction?
My recommendation would be, I'm hoping the extraction is being done at an oral surgeon's office. Their oral surgeons are going to be more specialized, and that should involve communication with your oncology team. So it's hard for me to say in this particular situation if this, extract the tooth or not, because I don't know exactly what that situation is. But typically you would like that to be done at an oral surgeon's office, one that has experience with people that are taking these medications, and then that it would involve a communication with your oncology team, because that is something every once in a while they may even say, let's do a drug holiday where we'll just stop it for this short time. But that's really up to those clinicians to put their heads together and figure out what the best route is to go for you. But I personally would avoid just going to a general dentist and having that done. There can be more preventive things that they can do for you to just minimize your risks through like antibiotics and antimicrobial rinses and things like that.
Thank you. And we always do try to direct very specific questions back to your medical team, but it is nice to know some of the options that you have that you might be able to bring up to them that they might not have suggested to you. So thank you. Another person just wanted to know, what toothpaste should they use? What brand?
Really, it's up to your individual situation. If you're in the middle of treatments, there's certain brands that I personally do like, and I have relationships with the companies or whatever. Like Closest is one that is very mild. It is it doesn't have the irritating ingredients. Other ones are Spry. Those are xylitol products. So Spry products are nice. Squiggle is another one, which has a silly name, and the packaging is actually kind of bland, but they're nice toothpaste. They're very, very gentle, and especially if you are susceptible to that tissue irritation or at risk for oral mucositis, those can be really, really helpful for reducing some of those issues.
Speaking of which, somebody else said that they're on a maintenance drug, Lymparza, and their gums get very swollen and they get mouth sores, and they've been doing saltwater rinses. And so is that recommended?
Yeah, those saltwater rinses, and that one recipe that I have where you can do the baking soda and salt water is soothing and help to neutralize that pH and help to kind of keep things cleaner in there too.
Sure. Somebody else was wondering regarding toothpaste, is Colgate whitening toothpaste recommended while they're on letrozole?
I would have to look up the medication a little bit more but I would bet you if number one, a whitening paste, maybe an irritant. I'm guessing I would bet anything that's sodium lauryl sulfate is part of that toothpaste. So if you're not at risk for mouth sores or tenderness and you don't have issues with that, there's nothing wrong with the toothpaste. But if you are at risk for some of those things, then that may just be kind of a tipping point for you. And it's not to bash Colgate or that paste in general. It's just those features of the paste, which are really common in a lot of different pastes.
Thank you. Someone else asked, should someone see an oral specialist during cancer treatment?
It would be ideal. The reality is not a lot of dentists specialize in this area. Not a lot of dental teams have training in this area. So if you are fortunate enough to live in an area that does have somebody that does have extra training and specialty, that is very valuable. Sometimes it's just interviewing your dental teams and seeing, have you had any extra training with that, and making your decision, I guess, of your caregivers with things like that. But if you are fortunate enough, I know I live in a very rural area, we wouldn't have the option for that. So it sometimes really is depending on where you're at.
Sure. I have just a couple more here. Somebody's asking, is a mixture of equal parts vegetable glycerin and water safe for dry mouth relief?
I don't think it would be harm if you feel like it's helpful. And again, everybody's so different what helps for them. I would venture to say that there are different types of gels and sprays that you can use that probably would be more effective. And with a lot of these gels and sprays and some of these lozenges, you can get ones that have like the xylitol in them, that they not only can help to reduce the symptom, but then they can help to protect oral health. So even though the oil, I don't think would necessarily be a detriment, I don't think it would be beneficial in a lot of ways besides just maybe being soothing.
Thank you. Another said, I used fluoride during my chemo months. I am still using it now. Should I continue? Fluoride toothpaste and mouthwash.
It's always good to just be on top of it. That's something that anything you can do to keep everything strong and healthy with your teeth is only going to benefit you in the long run.
We have a cute one here. When you were talking about toothbrushes, I use a kid's toothbrush, smaller and softer, the Muppets.
Oh, perfect. Yeah, kids' toothbrushes can be really helpful. And the smaller your mouth is, the smaller your toothbrush should be.
Definitely. I have one last one here. Are there specific questions we should ask our oncologists regarding oral care before starting treatment? Just curious.
I'm going to go back kind of to that. In the ideal world, I would love this to always be part, especially like a lot of people will meet with nurse navigators prior to their treatments that go through all of the, this is what you'll be, this is what your treatments will be, these are what the side effects will be, that kind of that counseling that a lot of people get. I wish that dental care would be part of that it would be like, okay, now before you start, let's make sure you see a dentist, make sure you don't have any cavities, make sure you don't have any infection while you're going through treatments, to make sure that everything is in tip-top shape as we can get it before treatments start. And that would hopefully help to reduce the risks of side effects, not only during treatments, but also long-term.
Thank you. Well, I don't see any more questions. So thank you everyone for offering up those questions for Jill. I do appreciate your participation. And Jill, we just want to tell you how much we appreciate you doing this presentation tonight. We've had a lot of women in our online Teal Hearts Network support calls that have talked about dealing with this issue and how difficult it has been during treatment and residual afterwards. And so thank you for all of the wonderful suggestions and all of the wonderful ways that we can be on top of things even before we know that we're going to go into treatment, so we can be in tip-top shape. So thank you so much. We really appreciate it.
Thank you. I appreciate it as well.